Hello, my name is Dr. Genevieve Hale. I am a clinical pharmacist at MMR Healthcare and an associate professor at Nova Southeastern University. Today I'm going to take a few moments to talk to you about the flu vaccine and go through some common questions that I get asked by patients. The first one is, can you get the flu from getting the flu vaccine? And the simple answer to that is no, luckily. And the reason for that is there's two forms of the flu vaccine. The more common form is the needle that you can get in your arm. This one is made of either a inactivated or killed version of the virus or from a single protein of the virus. And so there's no way to actually get the flu from that. And then the other form is a nasal spray form of the flu shot. And so this does contain live virus that's attenuated or weakened so that it will not cause illness. So with that said, both versions of the flu shot, or the flu vaccine rather, are weakened or completely dead forms of the flu virus. However, with that said, the second thing people tend to ask me is, why do I still feel crummy after I get the flu shot, or can I get side effects from the flu shot? So the answer to that is most people actually don't feel any symptoms, with the exception of if you get the needle version, maybe a little irritation or pain a few hours or after 24 hours from getting the needle, like any other needle. But some people do feel tired, drowsy, or have what we call flu-like symptoms, which could mean like you get sort of a runny nose, or maybe you'll have some coughing and wheezing, but it's usually very mild and goes away within 24 to 48 hours, and the side effects will also occur within 24 to 48 hours. There is extremely rare instances that you could have more serious side effects from the vaccine. This is usually in people who have had serious side effects from other vaccines before. So if you fall into that category, please talk to your healthcare provider, because there are ways that we can still administer the vaccine to you, but just in a very safe environment. But for the most part, again, people usually don't even get symptoms, and if they do, they are extremely mild. Another question that I get is, do I really need to get the flu shot every year? The answer is yes, and this is for two reasons. The first reason is that the flu vaccine, it lasts only over a period of a few months. So with that said, it's important that you get the flu vaccine at or around October 1st, when the flu season begins. And it will last until the end of flu season, which is usually around end of March, beginning of April. Some years it could be as bad as it goes until May. But if you get the shot too early, you may not be able to cover yourself for the rest of the flu season. So again, around that October 1st date's important. And this happens because we build antibodies against the flu from the flu vaccine, but those antibodies wane or they go away over time. So that's one reason why you need to get the flu shot every year. The second reason is that, unfortunately, there's many variations, variants, mutations, whichever word you like to use, of the flu or influenza virus. So with that said, the CDC every year makes an educated guess of the most common strands of the flu that are going to occur in the upcoming year. And so therefore, every year the vaccine is different because it covers 4 different mutations, variations of the flu. So just because you could possibly still have antibodies from the year before, it might not be the right ones that you need to cover for the variant of the flu that's occurring this year. Another question that I get is it better to be sick with the flu than to get the flu vaccine? Thinking, those antibodies would be good enough. And so the answer to that is no. So the flu can have really serious consequences, including death, particularly in patients who are very young. So very young children or old, so the elderly. Also people with respiratory conditions, heart conditions, and just a lot of underlying conditions, multiple comorbidities are at really high risk for serious complications such as this. And so it's not worth the risk of getting the flu versus the risk of possibly having a few mild side effects with the flu shot. So in my opinion, I wouldn't risk death over getting a needle. So then it's as simple as that. And then the next point that I would like to emphasize is that this year, like last year in particular, it's important that we get the flu shot because of the COVID-19 pandemic. Unfortunately, this pandemic is still here. The reason why this is important is because the symptoms of COVID-19 are similar to the symptoms of influenza. So respiratory issues could lead to death. And so it is important because if you do get these symptoms, at first it's hard to kind of differentiate which virus it is that you contracted. I know we have the rapid testing now, thankfully, but until you get tested, we don't know how to treat you. Number one. And then number two, if you get COVID, you're at higher risk of getting the flu. And if you get the flu, you're at higher risk of getting COVID. And so again, it's important that you get vaccinated, particularly this year also. With that said, if you have not already received the COVID-19 vaccine from Moderna or Pfizer, or if you prefer Johnson & Johnson, any of these, you should get this for the same reasons I'm telling you, because the symptoms are similar, it's treated somewhat differently, and if you get one, it puts you at higher risk for the other. Just because you get the flu shot doesn't mean you're covered for COVID. You need to get both vaccines, and so likewise, if you just get the COVID vaccine, it does not mean you are protected against the flu. You need to get both separate vaccines in order to be covered for both. The good news is you can get both vaccines at any point within each other. So what I mean by that is, let's say you want to get the flu shot today, you want to get the COVID shot today, go for it. You want to wait 2 weeks in between, you can do that. You want to wait a month in between, you can do that. Just recently, the CDC, World Health Organization, FDA, you can get your shots, both shots, at any point within each other. So that's a real nice benefit too to that. And then the last question that I get is, with the flu shot, do you need to get it twice within a year? And the answer is no. So once you get your flu shot this year, you are covered for this year, and you can wait until next year. So I hope that this video has helped clarify any confusion about the flu shot. I am happy to answer any further questions, either at MMR in person-to-person, face-to-face, or over the phone or via email. So you can just always ask somebody to reach out to me, and I will always get back to you. Thank you so much for your time. Please get your flu shot and your COVID-19 vaccine if you have not already, and have a great rest of your day.